Good day, all. First, I would like to thank you for the outstanding job you're doing for the community, the outstanding job you're doing with each other, and the outstanding job you're doing taking care of yourself wearing the proper PPE. I want to let you know, because we are basically getting some of the same questions over and over again, we're going to probably reduce the number of videos that we do. And we're going to make sure the videos are more case specific to circumstances that arise. I want you all to know I'm very, very proud of the work you're doing. You are doing an outstanding job. And as your fire chief, I am extraordinarily proud of how we've cared about this community and how you've cared about each other. So keep up the outstanding work. Keep up the amazing work that you are doing for Baltimore City. As always, you all take great pride in protecting people.
Hello, the fire department is planning for the worst and hoping for the best, while implementing programs to protect us all against COVID-19. Some of the things I wanted to go over today was just give you some high points of what's going on with a few of the programs that we put in place over the last few weeks. The first program, of course, is the Viral Syndrome Pandemic Triage Protocol. I want to give you a few updates. One, I want to go over the indications for using the triage protocol. First, remember the patient has to be between the ages of 2 to 55. They have to have 2 of the following 4 symptoms, which are fever, cough, body aches, or sore throat. They can have no history of immunocompromise or taking medications that suppress the immune system. There can be no history of diabetes, heart disease, COPD, or lung disease, and their vital signs have to be within normal limits, and then finally they have to be able to ambulate or walk. If the patient's agreeable and agrees to stay home, we're going to leave behind some information for them to convalesce at home, and of course we'll do a 24-hour call to verify that they're okay. We've had about a 20 to 25% success rate with this program. Every little bit helps with the low acuity calls for the ILIs or the COVID-like illnesses. Chief McCarron wants me to point out and remind everyone to please complete their elite forms for this pandemic protocol. Some other protocols or some other programs that we're working on right now is our telephone triage line. I talked about it last week, which is going to be our medical professionals, which is our senior paramedics and our dual licensed nurse paramedics. They're going to be screening low acuity or low priority calls. Please remember that the telephone triage line is screening alpha and omega calls, primarily the 26 card. That's going to be the sick card. All those calls, 26 alpha, this is for sick patients. They're operating from 7 to 3 and 3 to 11, 7 days a week. They have some robust protocols that were approved by the medical directors. They also do that 24-hour follow-up to make sure there's no adverse medical outcomes. They do 100% QA. And they're having a little better success in the triage protocol. They're having about 25 to 30% success rates. Some of the future directions of the program that we're looking at doing, one is we're looking at physician telemedicine. I had a call yesterday about getting into some of the telemedicine with both Johns Hopkins and University of Maryland. That program's probably at least 4 weeks out. There's a lot of legal that has to be taken care of between the two facilities and the city as well. The other program, the final piece of that, is the be able to leverage the mobile integrated healthcare, community paramedicine, treat and release vehicles. We have 2 of those vehicles 17 days this month, and the idea is to be able to send one east and one west to try to treat and release some patients. The final update I want to give you is on our commercial surge contract. Remember, in response to the anticipated increase in call volume, we were able to leverage a commercial contract. The existing call volume in the fire department runs 400 to 600 calls per day. They told us to anticipate, they being the state, anticipate our call volume to increase to 800 to 1,200 calls per day. They're there to provide assistance to us and to do low acuity calls. Low acuity calls for those units are the BLS profile, response profile. Basically, they predominantly take Alpha and Bravo responses. There are a few Charlie and there's one Delta that does come through. The one Delta that does come through in the BLS response profile is a 32 Delta 1. That card is for a man or woman down. That's going to remain with that profile. There's also a couple low Charlie level responses that will remain with the BLS profile. Now, some mistakes that we made early on within the first day or two, we realized that the 6 cards were going through, which is breathing problems. We took care of that and removed that from the profile for BLS profile. Also, the 9 card got through, which is actually a respiratory or cardiac arrest. We quickly corrected that, and it was corrected actually before it was dispatched. Remember, the number of units are going to be scalable. Last week we had 8 units on. This week and next week are anticipated to be the peak of the pandemic. So we're running 16 units this week and 16 units next week. Remember, once again, this is a temporary program, and as soon as the emergency abates, everything's going to go back to like it was prior to the pandemic emergency. Please protect yourself, protect your family, and protect your community.
The fire department has recently gotten some testing sites available for our members to be tested for COVID-19. Now, these testing sites only test for symptomatic patients only. The reason for that is if you're asymptomatic, you may not have a high enough viral load for the test to come up positive. So we don't test you unless you become symptomatic, so that will show up on the test. The preferred method is for you to get tested through your primary care provider. The reason for this is if you have any medical care that you needed, they can follow you. And you also have to see your primary care provider for the current temporary sick leave policy. So the testing referral options that we do have available to you are if you can't get tested through your primary care provider, or if it's delayed and there's a little bit of a quicker route. Basically, you're just going to give me a call, get in touch with me, and I'll let you know some of our testing options that I can make available to you.